Welcome, mamas, to another expert chat session. Today, I am joined by the wonderful and experienced OB and gynecologist, Dr. Poonam Arora. Dr. Arora completed her medical studies from New Zealand and Australia, and after that, she has been practicing across many hospitals in Victoria. We are so excited to have Dr. Poonam Arora with us today. So, welcome, Dr. Poonam.
Thank you, Ragini, for having me over. Yes, you have introduced me in very nice words and briefly and given a bit an overview of what I do. I'm one of the obstetricians who works out of southeastern suburbs. It's quite amazing, that, birth of a baby is the most joyous moment for a couple, and your obstetrician forms a very integral part of it. And I feel very fortunate that I am a part of it, not just during the birth, even during the pregnancy and afterwards. So thanks for having me over for this session, and I'm quite sure we would share some information, and I'll get to speak to the lovely crowd.
Awesome. Thanks, Dr. Arora. So let's kick off the session by understanding what is a cesarean birth. And we have a lot of members who are first-time moms or even second-time moms. So I really believe that this kind of preparation and openness towards another type of birth can really help you reduce that fear of birth. Because like it is said that birth is really unpredictable. So just having an open mind and knowing your options would really help any mom. So if you could just let us know, like, what is a cesarean birth? What happens in a cesarean birth?
And so it's quite amazing, how over the years, the concept of cesarean birth has evolved to quite a lot of extent. And now cesarean birth is a surgical procedure wherein the baby is born with abdominal incision, and it's surgical. The women skip it can be either an elective cesarean section. Elective means that you choose to have a cesarean section, which is absolutely fine in my opinion. A woman has a choice to decide the mode of delivery. It doesn't mean that, if you have chosen a cesarean section, then you lose out on any aspects of motherhood. You're a mother, so it doesn't matter. You can choose to have a, elective cesarean section, or you could, start, considering a vaginal birth. And if things were going very well, there were no concerns with the baby or with yourself, then of course, vaginal birth is fine. And if due to some reasons, because the labor is never predictable, you don't know how the events during labor will pan out. And if you needed to have a cesarean section after a trial of vaginal birth, then that is called an emergency cesarean section. Yeah. And as far as the elective cesarean section is concerned, that means the mom has chosen to have a cesarean section. I would never be judgmental about the fact if the woman chooses to have a cesarean section. We definitely, take into consideration, and it's an informed consent, and it's a joint sort of a, decision making which you make with your obstetrician. Doesn't matter who the obstetrician is. Now, there's certain, conditions, wherein it is definitely indicated. So there can be medical indications for a cesarean section during the pregnancy, or there could be a maternal choice of cesarean section, and it's absolutely fine, as I said. Now, the most common reasons why we do medically, advise you to have a cesarean section is either the position of the baby. That means the baby, instead of being head down, the baby's breech presentation, that his head is up and the bottom is down. Then of course, it is a very unpredictable mode of delivery. So we would offer the woman to have an elective cesarean section. Or if the position of the placenta is such that it prevents the baby from being born vaginally, then of course elective cesarean section would be indicated. And if during the pregnancy the baby develops some complications in the form of, fetal growth restrictions with abnormal blood flow through the placenta, then in those situations, we would give you a choice, and then you decide that which mode of delivery you would, like to consider. You could choose to have a elective cesarean section in those situations. So, so that's a difference between a maternal request for a cesarean section, which mom wants to have it, and it's absolutely fine. As I said, I'm not too, and don't let anyone be judgmental about yourself. So so these are the two very common sort of reasons why you would choose to have a cesarean section. And so during the pregnancy itself, you need to have that conversation with your obstetrician to make a decision regarding that.
Yeah, that's so true. And I know some friends who have gone for elective cesarean, and they still have found it quite empowering, and sort of knowing, like your baby's coming out on this day, and picking up a date for the birth can be, and they preferred that way. So yeah, like you said, no judgments, and just like we were chatting earlier, like it's just one part of your motherhood. So don't let your motherhood really rest on how you birth.
Of course.
Every mother is great in her own way. So
yes, absolutely. Like I remember a few years ago, somebody had asked a question from one of the women, and she said, "What do you think is an essence of womanhood?" So motherhood is the greatest essence of a woman. So it's absolutely fine. You can be a mother anyway. It's still the same.
Yeah, awesome. So Dr. Arora, like how you mentioned that either you can go for by choice, or there could be some medical conditions in which you might have to take that route. So even say someone because of an emergency they had to go the C-section way, even in that case, how can a woman or even the parents feel a little more under control and a little more involved in the process, so that they come out still feeling like they made the choices and things like that? So how does all that work?
Yes.
And what's your suggestion?
Absolutely. See, look, key to the management of labor, when you go into labor and we are, considering a vaginal birth, is the communication between yourself and your obstetrician. Informed consent, what we do is we make decisions together.
Yeah.
It's not one person, who's making a decision. I would always give the options, and I would explain them the pros and cons. That yes, so look, the labor started, everything was going well, you were making a good progress. Now, for some reason, the baby is not liking the labor, and the baby is unable to cope with the uterine contractions, or the fetal distress is, is making itself evident, and we need to act when we know that the outcome is going to be good. We don't have to, leave it longer and then make a decision. We have to make a decision together. It's all about ourselves, about yourself as a mother, along with your obstetrician, to make a decision at the right time. And the right time, what is the right time? The right time is the safe time for the baby and for yourself. So it's the key to decision making is communicating with each other, reassuring you that the baby is doing well, and if things are not going right, explaining it to you that no, this is the stage, this is what is happening to you. It's not just the baby, it's you too. I would be more inclined towards emphasizing your physical, well-being in comparison to, in comparison to the clinical scenario. And of course, baby is an integral part of it. Having a healthy mom and a healthy baby is what we all want. So as the labor is progressing, we communicate, we explain things, we take the fears out of your mind. And yes, the recovery process, everything is discussed. Short-term and the long-term complications of the Caesar are discussed with you if at all you need a cesarean section.
Yeah.
So there is a reason to it. It's the safe method, and of course, explanation and taking the fears away. And of course, it is at the end, it's the mother's choice and the couple's choice together.
Yeah, that's so true. Like that is why having a medical provider that you really trust and have a sort of a relation with them through those months, and really knowing them and they knowing your needs is so important, because at these times when they are suggesting something, you can only trust if you have known them, and you know that it would be in your best interest. Yeah.
And so look, as I said, your obstetrician, your clinical provider is the person who shares a very important part of your journey. Yeah. And the end point of the journey is safe mother and safe baby. And the decision has to be together,
Yeah, wonderful.
Taking all the aspects into consideration.
Yeah. So, Doctor, I have also heard in C-sections that, nowadays there is something called the maternal assisted C-sections, and, what's your take on it? And do you offer that kind of a service or something like that? Have you had much experience with that?
So look, I think you really touched on a very I wouldn't say it's controversial yet. So look, when we all were training, I know there are lots of factors which need to be taken into consideration for a maternal assisted cesarean section.
Yeah.
We have to, the most important aspect is to understand the infection control around the maternal assisted cesarean section.
Yeah.
It's not just a decision of the obstetrician that the obstetrician can offer a maternal assisted cesarean section. It's the couple as a unit. Then the anesthetist who's anesthetizing you has to be comfortable with it, because and the third aspect is your obstetrician.
Yeah.
Currently, our college has not set any guidelines on maternal assisted cesarean section, and we are still awaiting for the guidelines to come through so that it becomes a universal practice.
Okay.
There are some hospitals where they do maternal assisted cesarean sections, but at certain hospitals it's not being done. So it's very important to offer that to the women. Before you offer that to the women, to make sure that the hospital or the provider service which she has picked up is a place where they are allowing the maternal assisted cesarean section. So I have nothing against that at all. But do we have any policy procedures yet that it is a universal practice? The answer is not. There are no policy and procedures given to us by our college to say that yes, we should be offering it to women.
Okay.
So
the
currently, maternal assisted cesarean section, as I said, there are no guidelines or procedure which are set out by our college statements.
Okay. Is that something that you offer, or you have given the option to your patients at all? Or is it still evolving? I imagine it's still
evolving. I think it's quite evolving at the moment. At St. John of God, we are not, offering maternal assisted cesarean sections because there have been instances where we have had maternal assisted cesarean section by some obstetrician, but it's not a standard practice which has been followed so far.
Got it.
So but I have nothing against it. I would do it if I had a guideline and if I knew what to do exactly. From mother's point of view, from the anesthetist's point of view, and from my point of view too.
So Doctor, just for our members, not everybody is aware what a maternal assisted cesarean birth is. Would you just mind touching quickly on it, like what happens in it exactly?
in a maternal assisted cesarean
Yeah,
section.
yeah.
So in a maternal assisted cesarean section, the first is, of course, the woman needs to be, aware of it, what it is. Yes, motherness does have a lot of active part to play in it, in a way that, we do get the women to first, the person who's having a Caesar to, scrub quite nicely, follow the aseptic technique. And then, of course, as she has to wear, wear the gloves, the gown, absolutely in an aseptic technique as we do so. And the anesthetist has to lower the drapes as the baby is coming out, so that with her sterile technique, the baby is delivered from within. She doesn't take it out herself from the mother's womb. It's the obstetrician who helps to deliver the baby. Gets a head and shows her the baby's face, and then she picks it up and has straight away a sort of a touch feel with the baby. And then, of course, we cut the cord. Your obstetrician cuts the cord, and in a very sterile manner, it is handed over to the pediatrician. So it's the obstetrician, it's the patient, it's the anesthetist, and all four of us have to be in coordination, following all the aseptic techniques.
Yeah, I can imagine, it might need a lot of...
I wouldn't say it needs a lot. It needs a bit of more fine-tuning before it becomes a standard practice.
Yeah, and it might need a lot of, like you said, aseptic and keeping everything sterile and those considerations, because end of the day it's a surgery that's happening. So
yes, that's great. And so, as I said, if you go on the internet, we do have sort of a lot of information about it, and how at some private hospitals it's been done, but definitely it's not been done in any of the public hospitals I know of. In Victoria.
That's wonderful to know that the guidelines around it are still developing. It's a practice that's probably still evolving. So great. So coming on to the last part of our discussion, Dr. Arora, do you have any tips for moms entering the birth space, and be it vaginal birth or C-sec? Like, what's your advice? What are your top 5 tips for moms?
Yeah, sure. So, I'll just briefly give you a bit of an explanation of how the cesarean section, your elective or emergency ones happens. The most is, of course, first we obtain the informed consent, explaining the mom the short-term and a long-term sort of, complications. And then, of course, if you were doing a maternal request cesarean section, or if you were doing the Caesar, electively, we do it around 39 weeks. We do have sometimes requests coming in through to say that I would like to do a Caesar a little earlier at 38 weeks. But according to the current guidelines and the current data which is available, we do say that the best time to have a cesarean section, if the baby is fine, there are no fetal concerns, or mom has no other complications, it is to do around 39 weeks, because that's the time that the baby has best outcome as far as respiratory system is concerned. Even intellectual development of the baby after 39 weeks who are born is better. I mean, looking at the scores and the new data. So that's why that is the timing. So whenever you are having an elective cesarean section, if there are no complications, it's been uncomplicated pregnancy, please consider to opt to have a Caesar around 39 weeks. So that is the timing when you decide that this is the time, the right timing for me to have an elective cesarean section. And of course, now how do you prepare yourself for a day when you are having an elective cesarean section, or if vaginal birth went on to the emergency cesarean section, that would be slightly different. So we would, for the elective Caesar, we would tell you what are the hours of fasting, how long you have to be fasting for, 6 to 8 hours prior to the surgery, have the bloods done a day prior, and the mode of anesthesia to expect what will be the anesthetic given to you is to have a spinal anesthetic. We generally tend to do the cesarean section under spinal anesthetic, or if you had an epidural, which is a form of pain relief in labor, then topping up the epidural would give you the anesthetic effect locally while we are doing the cesarean section.
Okay.
Of course, I'm sure it's if it's an elective Caesar, when you enter the theater, we would put on the music, we'll try and relax. So the atmosphere is quite relaxed. In an emergency also, we do ask, do you want some music to be, to put on? Sometimes you find that the women have gone through labor. At that stage, they do not want the music to be on. So it's your choice how you want the operating theater environment to be when you have your cesarean section. Once you've had the anesthetic, we make sure that we clean your tummy with sterile solutions and then put in a catheter in the bladder, because you would not be able to get up and pass go to the loo straight away. And of course, it's done under aseptic conditions. And after you've had, at the time of cesarean section, you would have prophylactic antibiotics, that is to prevent you from getting an infection, and we give you medication to help the uterus to contract so that we can avoid the complication of bleeding. And of course, so that is a sort of a preparation and what to expect at the time. And afterwards, while you're in your room, we make sure that you have adequate analgesia, and that means a pain relief, so that you're comfortable. It's not that you had a Caesar. We would say that no, you don't have to be in pain. You have to ask for more pain relief if you need. So we want to make sure that you're pretty comfortable as far as the pain is concerned, so that you're adequately rested after the cesarean section. And in about 6 to 8 hours time, we can take the catheter out, and then we do encourage you to start drinking and eating. That concept is gone that, you have to be 24 hours in your bed. No, we do encourage you to mobilize quite early after the cesarean section. The mobilization is the most important aspect, because it does, prevent you from getting clots in your legs. And of course, seek the help of the services which are available to you in the maternity. The midwives are there to help you. The pediatrician would have assessed your baby. So, the aspects of feeding and everything, has been in place. So everything is quite orderly explained to you and is made available to you. So that's also an extremely important thing to know, what is available to you and how you can utilize it. And of course, I always tell the women, the most important thing to remember is that if you had a cesarean section, do not let anyone judge you, whether you had an emergency Caesar or an elective, and do not let others to judge you, and never be judgmental about your own self. That's your baby is safe. You've got a safe baby with a safe birth. That's what is the most important thing. And of course, supporting each other as a couple is the most important thing. Watch out for each other mentally and physically too. We so many times, we think of our physical health, we forget what are the mental aspects which we need to be aware of. So looking out for signs of tiredness, signs of anxiety, signs of feeling low in yourself need to be monitored and acted on quite quickly, would help you to make a better recovery. And of course, the most important thing is, doesn't matter where you've had your cesarean section, there are so much of resources available, so much of help available in the community around you, that seek for it and avail the services so that you make a faster and a sort of a more healthy recovery.
So, doctor, if somebody, you touched on a very important point, which is seeking more help and sort of not shying away if you feel like something is not good with me. What would be the best place if somebody needs any sort of help? Would it be like chatting to your GP, or what would be the first person whom we should go and talk about? Like sometimes people might be having they might not be feeling mentally well, or they could be feeling disturbed or something. So what's the first point that they should approach if they feel and they can't figure out like really what it is? But sometimes you can't pinpoint, like, is it just sleep, or is it like I'm not feeling well, those kind of things. So what's your advice on that?
Yeah, sure. So look, it's extremely important, if a woman's had a, elective cesarean section, then of course, that's a woman's choice. The person's organized, knows things, how they were to happen. But a woman who's had an emergency cesarean section, the most important thing is, as an obstetrician, as myself, I would always go and debrief them the next day. Sometimes when you go in the morning to explain it to them the next after 24 hours, the person, my patient say, Poonam, we would like to not talk about it today. Can we talk about it later? It's absolutely fine to say that. So debrief is the most important aspect, which as a clinician I would offer it to my patient. Okay. And then of course, we do have help in every hospital, wherein you can have a person, from the pastoral care or someone come in and talk to you and see that how you're mentally feeling in yourself. Do you feel like talking to someone, or are you in a state to talk to myself? So, offering these two ways can be quite helpful. Yeah. What I do most of the times, I would always tell the patient that, look, I do know you've gone through a lot. What has happened in the time the labor led to an emergency cesarean section. How about if I, ask your GP to make a mental health care plan for you, so that you can go and see the psychologist straight away after you've gone from the hospital? Mm-hmm. Because the mental health has been quite well looked after, specifically in the last 3 years, because the COVID isolated the couples together and isolated them from their family too. Yeah. So yes, seeing a psychologist, getting the GP to do a mental health care plan for you so that you can seek the services. And of course, I would always talk to the women that, look, the medications sometimes can help you to go through this difficult time. So if they are open to starting the medication, I'm quite happy to prescribe them safe medications and refer them to my colleagues for an expert opinion, to a close psychiatrist or, in the area would be quite helpful.
Yeah, and that's a wonderful point, that never shy away from seeking help. The best chance is just like it could just be like just a phase, and nothing is really wrong with you, and you would be better off in that situation.
Yes,
and the other side could be you're getting help. So
yes, that's right.
That's wonderful, and I am absolutely for debriefing. I feel it's so important. It's birthing is such a big event in a woman's life, and you need to talk about and you need to debrief. So
yes,
there are
so look, it's not only in cesarean section, even in vaginal birth, I think. And there are certain things, when things are happening, you as a clinician may not have noticed it, your patient would have noticed it, and giving the explanation and explaining things, I think, is the key to it.
Yeah, absolutely. Well, that was wonderful, Dr. Arora. Really, such a wonderful knowledge. I think it's a short session, but I have gained so much out of it. I have very less knowledge about cesarean births. All I know is what I've heard from my friends. But I think this session is going to be extremely beneficial for anyone who is pregnant and wanting an empowered birth, whatever route they take.
Yes.
So thank
absolutely.
you. Yeah, absolutely. Thank you so much, Dr.
And thanks
Arora.
for having me over. And I'll look forward to coming on to the sessions and sharing information would be the main sort of a primary aim. And I'm sure we all can learn from each other.
Yeah,
like it was
absolutely.
interesting about the maternal assisted cesarean section. There has been so much in the media about it, and we have been, at St. John of God, the committee has been doing to and fro that should we pass it to be done or not, or should we not do it. So, but I said, everyone, the experts are waiting for our college. RANSCOG is the college which guides our practice. So we are waiting for a college who trains us to say that these are the guidelines to do maternal assisted cesarean section.
Yeah.
Thanks. Are there any questions?
Yes, I wanted to check. We have a few women who are wanting to go VBAC after cesarean. So what are the chances, and is there anything that they need to know, any considerations with the second birth after VBAC, after cesarean?
Yes. So I see VBAC is a vaginal birth after cesarean section. I see it's extremely important to understand that once a cesarean doesn't mean always a cesarean section. Now there are a lot of considerations which need to be taken. Important is to get the indication of a cesarean section which happened the first time, the reason why the Caesar was done. Was there any complication at the time of the surgical procedure itself which prevents you from having a VBAC? So it's extremely important to get the operative notes from the place where you had a cesarean section, and the previous surgeon would have definitely made a remark of whether you're suitable for a vaginal birth after cesarean section or not. And now the success rate of vaginal birth after a cesarean section is almost up to 60%.
Oh, yeah.
So it's quite high. And look, our college has been encouraging quite a lot of women to consider vaginal birth after cesarean section. But as I said, there are no judgments about it. But yes, 60% is a success rate. And of course, we would wait for women to go into labor on their own. And once they have gone into labor on their own, then of course give them an adequate opportunity and adequate time to proceed towards a vaginal birth. So yes, the most important thing with the vaginal birth after cesarean section is to make sure that the women are aware of the fact that there is a very slight chance of scar giving open. It's not outside scar, it is the scar on the uterus, So, so you can definitely have a vaginal birth after cesarean section, but you would have to have in a sort of medical setting, in a hospital, where the heartbeat of the baby is continuously monitored, how the heartbeat reacts to the uterine contractions, because the first thing which would tell us that there has been scar opening is the baby's heartbeat, because that is the most important information. So yes, you may be tied onto the transducer and you may be tied onto the tube, the tubes which are connected to the transducer to check the baby's heartbeat. So yes, absolutely 60% success rate. Labor needs to be monitored. Early signs of fetal distress and the scar opening would be monitored quite closely.
And doctor, is there any guideline, like if you're going for VBAC, you can go up to this week, and then after that, if things don't progress, you might have to go for a C-section? So
so look, it's not necessary that as we said, we do encourage women who choose to have a VBAC to wait for them to go into spontaneous labor. If everything was going well during pregnancy, we wait up till exactly 41 weeks plus, because we do know that would increase their chance of going into spontaneous labor on its own. And of course, if by 41 weeks plus you haven't gone into labor, then we do offer women to consider induction of labor at 41 weeks plus with a cesarean section. But it's just the mode of induction of labor has changed over time. So we want to have a safe induction of labor. That means bringing the labor on in a medically facilitated environment where the hormone drip can be used after breaking of the waters in a safe environment, checking the baby's heartbeat with the monitor all throughout labor.
Okay. Is the induction method for a VBAC different to what it would be in if you went for a normal vaginal birth?
Yes, that would be slightly different in a way that we minimize the use of hormones.
Okay. Yeah.
So we do tend to use either, to open the cervix up, we use balloon these days, which we put in the balloon through the, through the cervix, and it opens the cervix up. And then the use of hormone has to be extremely, extremely cautious and judicious from the viewpoint that it does not have any adverse effect on the mother as well as on the baby.
Okay. Yeah.
So it's got to be quite monitored and very, very cautious.
Cautious. Okay. Yeah, that's something good to know. Awesome. Thank you so much, Dr. Arora. It was lovely to have you.
Thank you.
I can't wait to invite you for another session with our members and me.